Welcome to the first of the Ovarian Cancer National Alliance's 12-session webinar series. I'm Dr. Karen Orloff Kaplan, CEO of the Alliance, and I want you to know how delighted I am that you are all joining us today. This series is generously funded by Morphotek and Genentech. Just a few housekeeping notes before we begin. We won't have time to ask our first speaker, Tina Chin, any questions, but you can email us at advocacy@ovariancancer.org, advocacy@ovariancancer.org, and we'll make every effort to answer your questions by email. Dr. Lichtenfeld, our second speaker, will be taking questions following his presentation. If you have questions for him, please type them into the chat box. And finally, if you are experiencing any technical difficulties, please call 800-263-6317. That's 800-263-6317. Today, we're starting with an important message from Congresswoman Rosa DeLauro. Mrs. DeLauro has represented the 3rd District in Connecticut for almost 2 decades. She is an ovarian cancer survivor, and for all of her time in Congress, she has been a passionate advocate on behalf of everyone who has or will have any cancer at all.
Hello, everyone. I'm Congresswoman Rosa DeLauro, representing the 3rd District of Connecticut. I am proud to join you as a foot soldier in the struggle against cancer, not only in my official capacity, but also as a cancer survivor. As cyclist Lance Armstrong put it when he battled cancer, and I quote, "We have 2 options, medically and emotionally. Give up or fight like hell." And in that great fight, the Ovarian Cancer National Alliance has been in the corner for millions of American women. 24 years ago, I was diagnosed with ovarian cancer. I was lucky, had excellent doctors who detected it purely by chance in stage 1. I underwent radiation treatment for 2.5 months, and I am fortunate to say that I have been cancer-free ever since. I know I am one of the lucky ones. My life was given back to me and changed at the same time. And I know that had my doctors not caught my cancer at its earliest stage, the final outcome might have been very, very different. That is why it is so important that we do everything in our power to raise awareness about the disease. Getting good information out there can save women's lives. The Ovarian Cancer National Alliance's upcoming series of online webinars, which I am proud to introduce today, will help to provide this information. They will cover everything from what healthcare reform means to you, to the latest clinical trials, to the unique issues facing young cancer survivors. And they will feature a host of medical experts, policy thinkers, and cancer advocates, all joining forces on a single mission: to help put an end to ovarian cancer. For more information or to sign up, please go to www.ovariancancer.org. I strongly urge you to take advantage of this excellent resource. Trust me, I know from personal experience that information can save lives. Thank you, and thank you to the National Alliance for making this all possible.
Our first speaker is Ms. Tina Chen, who is the Director of the White House Office of Public Engagement and Executive Director of the White House Council on Women and Girls. Ms. Chen is by training a lawyer and by heart and soul a friend to everyone interested in improving health care in this country. We've been honored to work with Ms. Chen on a number of issues, including some provisions of the health reform legislation that will be helpful to women who have or are at high risk for ovarian as well as other cancers. Although we won't have time to ask Ms. Chen questions, please remember you can email us after the webinar and we'll make every effort to answer your questions by email. Ms. Chen is joining us from the White House. Tina, thank you so much. It's all yours.
Thank you, Karen. Thank you much for that introduction, and thank you to everyone from the Alliance for dialing in and signing on. And I am especially thankful to the National Ovarian Cancer National Alliance for putting on this webinar and really focusing on health reform, because I think it is, as Congresswoman DeLauro said, so important to all Americans, and particularly important, I think, to those of you who are sufferers and survivors of ovarian cancer. I am at the White House. I apologize in advance for not being able to stay on longer. We are we're working away furiously here on several things as we drive the year just to a close. But I did want to take time to be with you to talk about the importance of the Affordable Care Act. As you all know, I think on March 23rd of this year, President Obama, I think, had one of his proudest moments of his presidency when he signed the Affordable Care Act into law. It, for the first time in multiple generations, really addresses the issue of providing health care for all Americans and puts in place comprehensive health insurance reforms as well that will not only benefit those who don't have health insurance for today, but those of us who do have health insurance but don't have health insurance that really counts and covers us when we are sick. In particular, I wanted to focus on that area, which is the consumer protections that are included within the Affordable Care Act. So, for example, and this is a very important, I know, to all of you, and that is that the Affordable Care Act includes a bar on insurance companies refusing to insure people with pre-existing conditions. In 2014, when the Act is fully implemented, no health insurance company will be able to turn anyone away because they have a pre-existing condition. As of today, since September 23rd, health insurance companies are today prohibited from refusing children with pre-existing conditions up to the age of 19 from being insured because of a pre-existing condition. And then that will expand to everyone by 2014. And we know that's of critical importance to cancer patients. In addition, importantly, the really noxious practice of rescission that health insurance plans used to follow is also barred. That's the practice, and we know cancer patients in particular were focused on this, victimized by it, quite frankly, by some of the insurance companies. And that is the practice where health insurance dropped coverage just when someone got sick. Going back and finding a technical error, someone who didn't disclose that they took acne medication or any kind of mistake in their application to deny people coverage exactly when they got sick. And that is going to be prohibited, and it's prohibited now. It's one of the provisions that is taken into effect. When the law is fully in effect in 2014, we will have a bar on lifetime caps, meaning the dollar amount that insurance plans must pay for coverage, especially, as you know, when you get sick, you need that coverage. And today, many people find that although they were insured, they're only insured up to a limit. Some of the limits are quite low, and they don't cover the full cost of care. That practice will end. We are in the process right now of gradually setting, a ceiling that will work its way up to the fact that there will be no lifetime cap as of 2014 at all on what an insurance company will spend. They must, after 2014, cover all the costs of care. Insurance companies will be required to publicly disclose and justify unreasonable premium increases. And we know that for women facing aggressive cancers and with limited and difficult courses of therapy, the Affordable Care Act is going to make a world of difference for all of you. Instead of worrying about how to pay for care, or we heard many stories during the real struggle to get the Affordable Care Act passed of women who had to choose between medication and mortgage payments, breast cancer or ovarian cancer screening and continued treatment, and their family's family home. Now these families will not face those choices and be able to focus on beating their cancer and getting healthier. In addition, we have, for new plans purchased on or after September 23rd, these new plans, if you sign up for a new plan right now, that plan has to cover recommended preventive services free of charge without a copay. That includes things like mammograms and colonoscopies. For children, it includes immunizations and well baby care and well child care. And so it includes also women's health services and counseling related to certain genetic screenings that identify increased risks for ovarian cancer. And we're in the process on women's health of a broader study by the Institutes of Medicine for what other kinds of screenings and preventive services and treatments should be part of a comprehensive women's health prevention package. And we expect that study by the Institutes of Medicine to be done in August. In addition, our current consumer protections now in place guarantee you that you may have a choice of any available primary care doctor in your plan's network, and that can include actually having your obstetrician gynecologist be your primary care physician without having to obtain a referral first. And finally, one of our consumer protections includes coverage of services provided by an emergency room that's not in your network without prior approval or without greater cost sharing. We also have a new program that is sort of a bridge program right now, because we know the law will not be fully implemented until 2014, when there will be the insurance exchanges will come into place, and there will be subsidies for those who can't afford to buy care to really have care provided for everyone. But until then, we know that there are people who cannot get insurance coverage today because they have a pre-existing condition. And so we have the pre-existing condition insurance plan that is available right now, either through HHS or through your state, to help provide a place where people with pre-existing conditions who've been uninsured for 6 months can find a place to go to find affordable premiums a pre-existing condition plan that will cover and provide health care coverage for them. That includes women like Gail O'Brien from New Hampshire, who we heard from her family shortly after this plan was announced. She'd worked all her life. She never had insurance coverage, and when she had lymphoma, she had nowhere to turn to for her health care coverage. And so she had to wait for her treatment to start until the program was established, just 3 months after the Affordable Care Act was signed. And now she's signed into a pre-existing condition plan. She's got coverage, and she's getting the treatment that she needs. Let me give you 2 websites to turn to for more information, both about insurance coverage. And first, that's www.healthcare.gov. It is a very user-friendly website that has comprehensive information about health care and the health reform law, but also can help you find insurance options for you. It has pages where you can input some basic information about yourself, whether you're employed, what state you live in, whether you have a pre-existing condition, and that website will be able to direct you to available insurance plans and allow you to compare them and find out more information, as well as to give you information about the law. You can also get more information about the law at whitehouse.gov/healthcare, which is where we have most current breaking news about the law and information and blog posts and videos that can help you understand what the breaking news is. And what I want to turn to now is talking about one piece of breaking news that some of you may have seen about this week, and that is the litigation that's going on regarding the Affordable Care Act. As you may have followed, there are multiple lawsuits that have been filed around the country trying to overturn the Affordable Care Act, either the entire act or various portions of the act. There are several different opinions. We have actually, in several opinions, we have succeeded in defeating those challenges. But we had a recent court case this week brought by the Attorney General of Virginia and other states challenging the constitutionality of the Act, in which a very specific portion, while upholding the balance of the Act, a very specific portion of the Act, namely the individual mandate, it's been referred to, the requirement that everyone purchase some form of health insurance when the Act is fully implemented in 2014, challenging the constitutionality of that. And I think we are confident, based on what we've seen from other courts, what I think almost most constitutional scholars who have looked at this and written about it have said is that the individual responsibility provision of the Affordable Care Act is constitutional. That similar challenges to new laws like the Social Security Act, when it was challenged when it first came into place, the Civil Rights Act and the Voting Rights Act, all of these major landmark laws that are now really just part of the fabric of our country were challenged also in the courts. And we're absolutely confident that the Affordable Care Act, like those acts, will weather these constitutional challenges and will be upheld. Just to be clear about what the individual responsibility provision is, as I mentioned, it is the piece that would require everyone to get insurance coverage. The Act also provides that if you can't afford it, that there are tax credits that will help you pay for it. And if you have certain hardships or there are certain other provisions, there are ways to get exceptions from that individual responsibility provision. But the provision is an important part of a comprehensive system of healthcare reform, because by insuring everyone, then that enables us to keep premiums low while we're doing things like requiring insurance companies to pay for the full cost of care without lifetime caps, to cover everyone, including people with pre-existing conditions, because both healthy people will be required to buy insurance as well as people with pre-existing conditions or people who are sick, so the cost of care can be spread across it. But right now what we have is a system where some people either cannot buy health insurance because they can't afford it, choose not to buy health insurance because they feel like they don't need it, and then when they do need care, they go to the emergency room. They become part of the uncovered, uninsured costs of care that are, quite frankly, raising the cost of care for everyone throughout the system. And so this individual responsibility piece is an important part of a very interconnected, integrated piece of health insurance reform that really allows us to do all of the consumer protections as well as provide all Americans now with health insurance coverage. I think the court challenges are not the only challenges to the Affordable Care Act. There are several news reports that have said that in the new Congress there will be acts to repeal the Affordable Care Act. Again, we're very confident that Americans, as they learn and they understand more about what is in it for them, and there's something in this for everyone in healthcare reform, that they will understand and support this tremendous step forward for our country. You all can be very helpful in this. And I again want to thank the National Alliance for putting on this webinar, because this is so important in informing you, giving you the tools that you need to understand the law and to communicate it to your friends and your neighbors and your colleagues, because in many ways, you are the most trusted messenger for all of them, and people don't necessarily want to hear those of us in Washington talking about it. I think they will understand it if you know it and you can speak about it and you can explain how this will benefit their families, how it benefits you, especially those of you who are living and breathing and working through the challenges of our current healthcare system. So I want to thank you for all of that. Please do check out healthcare.gov and whitehouse.gov for current information. We constantly keep them updated. We will be happy to answer your questions later. And I know if you have other questions for us or anything we can do for you, please let the National Alliance know, and Karen and her colleagues will be in touch with us, and we're really here to serve you. So thank you again, Karen, for the opportunity to address all of you. Thank you all for tuning into this, and I look forward to working with you all in the future.
Tina, thank you so much. That was certainly informative, and we appreciate your joining us to help us understand this complex issue. Now, it's my great pleasure to introduce Dr. Leonard Lichtenfeld. Dr. Lichtenfeld is the Deputy Chief Medical Officer of the American Cancer Society. He directs the Society's Cancer Control Science Department, which produces the widely recognized guidelines for prevention and early detection of cancer, as well as the guidelines for nutrition and physical activity for cancer survivors. Dr. Lichtenfeld is a board-certified medical oncologist and internist who is a practicing physician for nearly 20 years. He has been active for many years in medical affairs on a local, state, and national level, and has a long-standing interest in legislative and regulatory issues related to medicine. He serves on several national committees focused on physician payment, the quality of medical care, and the role of information technology in healthcare delivery. Bottom line, much of Dr. Lichtenfeld's career has been devoted to improving the care that cancer patients get, as well as working to find cures. I've long worked with and admired Len. He and the American Cancer Society are great supporters in the fight against ovarian cancer, and I'm so happy that he can take us through some of the nuts and bolts of health reform. Len?
Karen, thank you so much. Can you hear me okay?
Yes.
Okay, just want to make sure because we've been having some connectivity problems, but I'm glad it's working, and I want to add my welcome, my appreciation to the Alliance, and certainly welcome to everybody who's joining us on this webinar today. I am here, happen to be in Washington today, and although normally in Atlanta, but I'm here with some of my colleagues from the American Cancer Society, and we're going to talk a little bit about the Affordable Care Act and what it means to cancer patients in this country. And certainly, as Ms. Chen has already mentioned, at the end of this discussion, we'll have an opportunity to answer some of your questions about the Act and, of course, anything else that comes up as a result of this discussion. Ms. Chen has covered a number of the issues, but let's go through some of the points about the Affordable Care Act. And I think one of the most important is many of us have struggled, not only as patients and families and caregivers and loved ones, but also as me as a physician, with the question about what kind of a healthcare system do we have. And it's very clear that what we have had for many decades, although the technology is terrific and we can do some really wonderful things for many people, the reality is that we concentrated pretty much on what we would call a sick care system and not a health system or a system that's oriented towards trying to keep people well and then addressing the issues that do come up when we become sick and need medical care. So before this Act, the reality was that insurers could deny coverage because of pre-existing conditions, and many patients, particularly patients with cancer, and I think is a very sensitive point to many of the folks who are on this call, the care became unaffordable. They couldn't afford to get the care they needed, couldn't afford the medications, and if anything, we see that problem has been expanding over the past number of years. And of course, a lot of plans that we, as mentioning a sick care system, didn't cover a lot of the screenings that we know that for early detection and perhaps prevention of certain cancers. Those weren't covered as part of our healthcare system. So there are some other issues as well. And part of that is that if you lost your job, for so many of us, our care was attached to our job. If we lost our job, we lost our care. And just to not take too much time away, that affects a lot of us, including me. I, at the time, I didn't lose my job. I left the job. My care was attached to that job. It was extremely expensive to maintain that care. I was in a place where I did struggle, but I was able to pay. But a lot of people could not pay, could not cover the cost once they left their employers. And then if you got sick, the insurers sort of found a way to say, well, by the way, we're not going to cover you anymore because of X, Y, or Z. And that was called rescissions, and we'll talk more about that later in this discussion. And then, of course, there was the issue about covering the amount of care patients and their survivors could receive. There were very clear limits, and for some people, they didn't even know they had those limits until they became ill, and they found out how, although it seemed like a lot of money, the limits seemed very high, the lifetime limits. The reality was they could exceed those limits, and then they would have no further insurance coverage. Well, the American Cancer Society began looking at this question about health care and access to health care and the impact of insurance on health care outcomes a number of years ago. And it's that research that we use to inform and educate ourselves and then educate and advocate on behalf of the people who rely on us to move forward in developing support for a plan that would improve what was as I said, the old sick care system. So what did we find? Perhaps most important in terms of cancer, we looked at a number of different diseases, and they're coming up as you can see on the slide presently. And what we found out was what probably many people thought was the case, but the science never showed it. But we did demonstrate that a number of cancers, breast cancer, cancer of the head and neck, laryngeal cancer, tongue and tonsil cancer, among others, that if you had insurance, you were diagnosed at an early stage, and if you didn't have insurance or had inadequate insurance, then the chances were significantly greater your cancer was going to be diagnosed at a much later stage. We even found out, and not shown on this slide, in colon cancer, that people who had insurance, even if they had more advanced disease, did better than people who had earlier stage disease. It didn't make any sense, but that's what the science showed us. And we at the American Cancer Society and our many millions of volunteers around the country came to the conclusion that that was basically not acceptable. So what did we do? We knew that in order to fix the system, we worked on this, for a long time, and came to what we would call 4 fundamental principles that we adopted and held close as our guideposts, so to speak, excuse me, as we went forward in this process about trying to develop a more effective healthcare system. And what were those four principles? We call them the 4 A's. Adequacy of health insurance, meaning timely access and coverage of the complete continuum of care, from prevention through treatment, through palliative care, through addressing quality of life issues. So adequacy. The second A is affordability. People obviously need to be able to afford insurance. It doesn't do us any good if the insurance is so expensive nobody can afford it, or if the deductibles are so high that average folks couldn't possibly meet those deductibles. Even in the Medicare system, for example, some medications, as we know, with a 20% copay, if you don't have insurance to meet that 20% copay, if that medicine costs $50,000 or $100,000 a year, you forget the cost of treatment, the cost of medicine. There aren't many people around who can reach into their pocket and pay for that. So insurance had to be affordable. Availability. It had to be available regardless of your past history, and hopefully it has to be available wherever you live in this country. And a lot of places don't have access to care. And then finally, administratively simple. It means clear, understandable, plain, ordinary English that we understand in our insurance policies, what's covered, what's not covered, and forms that are simple. I got to tell you, it's not just patients who have to fill out those forms. Come into a doctor's office and deal with every different insurance, every form, and every box, and every place. We need to get some simplicity and uniformity into the system and help reduce the cost of health care in the United States. So we took these 4 A's, and we eventually we supported the act in the sense of what it did for cancer patients, looking through the lens of cancer patients and cancer survivors and cancer care and their caregivers. And yes, this is an important act. It is not a perfect act. It is the law, and it will need to be improved over time. But we need to address, we need to look at it again through the cancer lens with those 4 A's: adequacy, affordability, availability, and administrative simplicity as our guideposts. So let's take adequacy first, because the law allows more cancer patients and survivors to get the care they need. And what does that mean? It means that the copays for proven preventive services in new plans starting on or after September 23rd of this year, and in January 2011 for those in Medicare, that copays for preventive services that work are gone. And that means that even for some people, the research shows us that even a small copay is a barrier to getting a preventive or a service or an early detection service for cancer patients. So those copays are gone. The second element is that health plans sold on the exchanges have to cover essential benefits on the continuum of cancer care. And although that's still a work in progress, very much a work in progress, and we at the American Cancer Society and others are going to be working and weighing in on that process, we need to determine essential benefits that are going to cover the continuum of cancer care, again, from prevention and early detection through diagnosis, through treatment, through follow-up care, and, yes, through end-of-life care, making sure that palliative care services are available throughout that process, and making sure the quality of life is addressed as well. And as I mentioned a moment ago, treating pain and improving quality of life is something we haven't paid much attention to, and as much attention to in this country as we need to. And through the Affordable Care Act, we're going to increase our abilities to provide those services. Some other issues that are being addressed is a yearly checkup to discuss disease prevention. You know, it seems so logical that you should be able to have time with a healthcare professional once a year, particularly on Medicare, because many folks on Medicare, not only cancer patients, but many people have a number of chronic diseases, and there's no way to really get them in the door, so to speak, to sit down and have that discussion. And yet that discussion and that relationship with the health professional, we know, is so important in improving health care in this country. We're going to be closing, the Act is going to close the Medicare donut hole so that seniors don't have to worry about hitting that period in their Medicare drug coverage that they can't afford their medications, get the medicines they need. And it's going to make the coverage available and improve the coverage that's available for patients who take care, who participate in clinical trials. So let's move on, if I can, and talk about particular patients. And the first one we're going to discuss is a lady named Kathy Hansen, who is a lady who has had breast cancer and has breast cancer, living with breast cancer. So Ms. Hansen's from Wrightstown, Wisconsin, and she was diagnosed with 2B breast cancer in 2003 at the age of 48. And they found the cancer through a routine mammogram, and she had health insurance through her job. She had a substantial amount of chemotherapy, she had a mastectomy, and she was on ongoing hormonal therapy to treat this cancer. She has remained cancer-free, and clearly early detection helped to improve her outlook and, with regard to her disease. But so what does that mean in terms, how does that translate into the Affordable Care Act? Well, what we're going to using Ms. Hansen to illustrate is that is the A of access to preventive care. And so there's guaranteed coverage of proven preventive care services without copays. So that means if you have a colonoscopy, and I don't know if you've ever seen the cost of colonoscopies, but if you have a colonoscopy for looking for colon cancer before to find a polyp so you don't get colon cancer, there's no copay at this, under this act for that service. And the same thing holds true, as I mentioned, that started in new plans in September of this year and will start in Medicare in 2011. Let's move on to affordability, because I think that one of the key issues for cancer patients, one of the things we saw at the American Cancer Society through our research was the substantial number of people who ended up in bankruptcy because of the cost of cancer care, and people with other illnesses as well. Medical bankruptcy not only was, it remains a serious issue in this country. The Affordable Care Act is going to address that. So how is it going to address it? It's going to see that limits, lifetime limits of benefits will no longer exist. And although sometimes those benefits may be $1 million, and that sounds like a lot of money, if you become sick with a cancer, with the new drugs, that lifetime benefit can disappear very quickly, and surprisingly so. And there won't, over the course of the next several years until 2014, annual limits, that's maximum amounts that insurance companies will pay for your care each year, those will disappear by 2014, and that will occur gradually over the course of the next several years. Making care affordable also means that in 2014, health plans will not be able to charge more based on your health status. I talk a lot about myself, and I have a blog, and I write about myself and my problems with my diet, my exercise, my weight gain and loss, and my medical problems and all that, so I can speak freely on that. If I have a medical condition, and I do have several chronic conditions, like many people do, that could impact the ability for me to get health care down the line. Or if I go to a new employer, if I go to a small employer, it may impact the amount that that small employer has to pay per person because there are not a lot of people in that risk pool. So there will not be charges based on health status beginning in 2014. And also the amount of out-of-pocket costs and deductibles are also going to be limited beginning in 2014. And I think as we talk about how people are going to be able to afford to get health insurance, the key issue is how do we help people who need help? Healthcare, insurance, if you've taken a look at how much it costs per family, per person in this country for health insurance, it's a lot of money. It's not inexpensive, and there are a lot of folks out there who say, I want to be able to get health insurance, but I have to, what am I going to do first? Pay my rent, feed my family, the necessary expenses of living. And when you look at the bill for health insurance, even if you can get it, sometimes it's unaffordable. So the Act is going to provide financial assistance for low and middle income families, and it's going to provide tax credits for small businesses so they can afford to cover their employees when today it may be a serious problem for them as they make a decision, as they allocate their money. Even though they want to do the right thing, even though they want to take care of the people they work with, many small businesses are family-run operations. Many of the people who work in those businesses are, in fact, almost like family. And yet, when you start looking at the numbers, they're so high, the tax credits will help make that decision easier for small business. Let's look at another patient, Anne Renault, who happens to be an ovarian cancer survivor, like many of you listening to this call. Ms. Renault lives in Essex, Maryland. She not only is an ovarian cancer survivor, she has had other cancers as well, uterine and skin cancer, breast cancer, and she's had recurrences of some of these cancers. So she's been a cancer survivor for 33 years. And you can only imagine over that period of time what her medical bills have been like, and her doctor bills and hospital bills. And she ran into that, what I referred to earlier about that lifetime limit. You know, that $1 million limit that people look at and say, I'll never get sick, it costs me that much money. Again, you would be, as many of you do know, how quickly that can happen. So at age 60, she can't get Medicare. She's 5 years away from being eligible for Medicare, and if she lost her insurance coverage, she'd be obviously in a very difficult circumstance. So what does the Affordable Care Act mean to women like Ms. Renault? It means that she won't have to worry about the lifetime limit because that is being removed over time. And it's going to remove the ban on yearly limits, and she won't have to worry that if she needs more care from any one of the multiple cancers. And I think it's fair to say, again, many people on this call are aware of that. Ovarian cancer specifically is a different disease today than it was 30, 40 years ago. It is now becoming more of a chronic disease, and many women live with ovarian cancer over many years. And so those lifetime limits, those annual limits, do make a real difference in terms of the disease is difficult enough to have to face. But to have to worry about whether my insurance is going to run out, and what do I do if it does run out, that's one less concern that people will need to worry about. Well, let's talk about availability as the next topic. And I'm going through this sort of quickly in the interest of time, but I hope that at least you're following through with me, because these are all, I think, and we think, are important points in understanding why the Affordable Care Act means so much to patients and their families, patients with cancer and their families and their caregivers. As Ms. Chen mentioned earlier, the law makes available high-risk pools in states to cover people with pre-existing conditions as a temporary sort of process to help us transition into 2014. So people with cancer and other pre-existing conditions who have no insurance for 6 months or more are eligible for these plans, and they started in July of 2010. Children are covered, and they cannot be denied for pre-existing conditions. And there are children, as we unfortunately know, with diabetes, and there are children with cancer. So that's important. The plan, the Act ends rescissions, and I mentioned that earlier. That means, oh, now you had cancer, that's an expensive illness, but you forgot to tell us that you had acne when you were 13. And because you didn't tell us that, or maybe that may be a little bit of an exaggeration, but it's an example of some of the things you worry about, that cannot happen anymore. The Act will create health benefit exchanges in every state, and the state has the option of making the decisions to run the exchanges, to provide shall we say, the infrastructure, the backbone to make the exchanges work, and if not, then there will be help from the federal government to see that that happens. But exchanges have the option to be local, and they have the option to be sensitive to the issues that are faced in people in a particular state and constructed in a way that's sensitive to those issues. In addition, care is going to be made available because guaranteed coverage. You will have access to an insurance plan that will provide you with that insurance coverage that's so important. It's also, there are a lot of things that happen in the insurance system in a sick system providing care for sick patients, in a less than perfect system. And one of the things that, again, speaking personally, I've even seen it happen in my own situation, and that is adequate networks. Somebody sells you a plan, but by the way, we don't have the doctor that you need. And that doctor's out of plan, so you have to pay out of pocket to go see the doctor who may have the expertise, a GYN oncologist, for example. Or maybe you live in a community where they sell you the plan, but there's no hospital or no radiologist. Those are things that have happened to me personally and happened to me very recently. So the plans are going to have adequate networks, and the plans are also going to provide prescription drug coverage and make those coverage more affordable. We at the American Cancer Society and our advocacy affiliate, the American Cancer Society Cancer Action Network, are going to advocate for comprehensive drug coverage as part of the essential benefits package that are going to be put forth in health exchanges I mentioned a moment ago. But let's go into another patient situation. And this one is, if not personal for me, it is personal in the sense that I've had the opportunity to meet Mr. Broderick, and he addressed our national staff at the American Cancer Society recently. And it's sad to see, it's sad what we deal with each in our personal lives. It's sad to hear the story and to see a man stand up there who's worked his whole life. He has to be a truck driver, and he's worked his whole life. He's been as responsible as he possibly could, and tell a story that brought tears to a lot of eyes of a lot of people because of what happened with Mr. Broderick and his wife Sharon. Mr. Broderick lost his job, and he and his wife lost their health insurance. She had a pre-existing condition. She could not get insurance, and then she was diagnosed with advanced cancer. And Mr. Broderick, as he told us at the American Cancer Society, that he said it was not a matter of whether, as long as I had money somewhere, I was going to use it to help take care of my wife. But he didn't have enough money. He ran up a substantial amount of bills, and she could not get all of the treatment that she needed. And that she did not get it because Mr. Broderick, who has worked hard his life, could not get health insurance to take care of his wife before I'll emphasize, it wasn't that he said, well, I didn't have insurance, I took a chance, and whatever. This is a man who wanted to do the right thing by his family and could not do it. So let's talk about the Affordable Care Act and what it means to people like Mr. Broderick. What it means is that if you have pre-existing conditions, you cannot be denied coverage. It is, in a sense, a leveled playing field with access for everyone. And that's a lot different than what it is today. And it also means, as we've talked extensively during this conversation, people like Mr. Broderick won't lose his wife because he doesn't have enough life savings to pay the bills. And he is continuing to pay the bills and will be for some time. Finally, let's talk about trying to make health care more simple. And that's sort of a difficult thing to do because all of us know health care, the technology and the care itself is complicated enough, but there's a whole set of administration issues behind health care that's very complicated, very expensive, and very difficult for everyone, patients, doctors, hospitals, health professionals of all types to deal with. So how do we make it easier to understand? We do that by trying to make the information more understandable. Sounds sort of simple, but in fact it's difficult sometimes to do. We know that there's, in our own experience, for example, in auto insurance, we know some companies make a real effort to try and make their policies understandable, and some companies can make them as complicated as possible, and you never read it, I never read it, you have an accident, and they say, well, you see this line here, that's what this means. What we need is clear, understandable language so everyone can know what's covered, what's not covered as part of their policy. Setting standard rules. Now, everybody, and speaking as a doctor who formerly was in private practice in the past, the rules are so complicated, and when you have so many insurers around the country and they all have their rules, I got to tell you, it is extremely difficult to try to understand those rules. You as patients and family members face these issues. This is something that we really could do much better as a nation when it comes to saying, these are the rules we're going to live by, and try to do some of the complex things we deal with every day. And then finally, on this particular slide, talking about giving patients new rights to appeal denied claims with their insurers. And then by 2014, and this is probably one of the most important parts of this plan, trying to make, understand what exactly are you getting? What are the differences between the plans? So one may be more or less expensive than another. Not related to healthcare, but this morning I was reading an article in the newspaper talking about how we have apps that help us find the lowest price. This is Christmas and the holidays, and people are out buying presents. We now have applications on our apps, on our iPhones and whatever. You press the app and it tells you where the cheapest price is, maybe next door. We don't have an app to tell us which health policy really does what. And part of this act is to try to make that understandable. I tried to help my son, who happens to live, it's not important, happens to live near Washington, buy health insurance about a year or two ago. I know this business. I've been involved in it, and I gave up trying to understand the difference between the different plans. I had to switch through so many screens, and they were this point here and that point there. We've all had sort of that same experience, whether it be with health insurance or something else in our lives, and that's what this act is supposed to address, making that information understandable. So, the bottom line is that there's going to be a lot of patience required by a lot of folks to make this work. We at the American Cancer Society, as I mentioned before, and at the American Cancer Society Cancer Action Network, we let our science guide our policy. We looked at what the issues were, and then we said these are the points that we need to address to make this system work, and we looked at it through the lens of the cancer patient, through the lens of the cancer patient's family, through the lens of the cancer patient survivor, and we, as going forward, as we talk about central benefits and the substantial, significant discussion that has to occur, make sure that coverage is available throughout the cancer experience, whether it be prevention, early detection, treatment, survivorship, quality of care. That's what has informed our approach to this, and that's what informed our support for the Affordable Care Act. And that's why we continue to believe that this is something that is valuable and important for cancer patients and their families. But it's not, there's some real benefits that are happening now. There are more benefits that will be coming over the course of the next several years, and there will be changes that will occur. That's inevitable when you deal with anything as complicated as this healthcare legislation. And we at the American Cancer Society, we at the National Alliance, have to be involved and have to be engaged to make sure that our voices and the voices of those we represent are heard. So with that, and Karen, I'm going to turn it back to you. We're going to have the opportunity to answer some of your questions. And joining me here in our office in Washington is Stephen Finan, who's our ACS Cancer Action Network Senior Director of Policy, and Keisha Brooks-Coley, who's also with ACS Cancer Action Network as Associate Director of Federal Relations. So with that, Karen, thank you, and thank you all for joining us this afternoon, and we look forward to continued discussions about this very important issue.
Len, thank you so much. We'll begin to answer questions now. If you have a question for Dr. Lichtenfeld or his colleagues, please type them into the chat box. And again, if we don't get to your question today, email us at advocacy@ovariancancer.org. That's advocacy@ovariancancer.org, and we'll answer as quickly as we can. Len, do you have questions on your screen?
I'm looking. I don't see any. So let's give it a moment.
Okay.
Karen, here's one.
Okay.
Let's talk a bit about, the question is, how does this law help women who are diagnosed with ovarian cancer? And I think that's a critically important question, because as I mentioned during my talk, ovarian cancer is obviously a serious disease, and again, as the folks involved with the National Alliance are very well aware. It's a disease that too often is diagnosed at a late stage. So many of the folks on this call, many of the women on this call or their families are familiar with that. It's a disease that requires treatment over a period of years for many women, and certainly with the cost of some of the new drugs that may, and I'm not certain what's going to happen, but there are new drugs that have shown benefit of ovarian cancer that have not yet been approved, but are probably being used, shall we say, off-label. Those drugs are very expensive. Put aside the question of, the cost of the actual treatment, of the giving the treatment and the mechanics of that, the cost of the drugs are expensive. So what this law will do is several things. Number one, it's going to say if you have ovarian cancer, you have access to insurance coverage. If you have ovarian cancer, you will not lose your insurance coverage. If you have ovarian cancer, you will be able to get the care you need without a limit on how much that care costs. Of course, that all assumes the care is appropriate and reasonable, medically, all those kinds of things. And it means that if you have a many-year experience with ovarian cancer, that if it's very expensive in 1 year, I talked to a lady a couple of weeks ago, and this lady had ovarian cancer beginning back, I guess, 2006 or 2007, and she had gotten her treatments. And then, she had a break in her treatments. And then the cancer came back, she got more treatment. And then she had problems, and she needed medical treatment for surgery, took a break in her treatment again. And then she came back, and now they say she needs more chemotherapy. Again, a story that's not unique to the people on this call. And it means that when this lady now, who started her journey, I think if I recall 2005 or 2006, doesn't have to sit here in 2010 and 2011, and particularly in 2014, worrying that she's going to lose her insurance coverage or lose it because of a lifetime benefit or something along that line. And, one of the other things I think it's important is that, and I think I want to emphasize something that's critically important for people to know. You may ask, well, what's going to be covered and what's not going to be covered? Is this like an insurance policy? We've all seen those lists in the insurance policy, particularly if we work, and they say we're going to cover hospital admissions, we're going to cover radiology, we're going to cover the emergency department. That's not, I don't know if that's where we're going to start or not, but this is what I'm trying to say. There's going to be a lot of discussion over the next year or so, and probably, hopefully, ongoing beyond that, to try to come together and say what can we cover? What is going to be part of this essential benefits package? There's still a lot of unknowns because it's not written in the law what's going to be covered and not covered. So first, the Department of Health and Human Services is going to turn to the Institute of Medicine, which is a highly respected group, to try to set a framework of how we make these decisions, what's going to be covered as part of the essential benefits package. And then we're going to have discussions among a lot of folks about what needs to be in there. That's something that's important to the Alliance, particularly on behalf of ovarian cancer patients. That's something that's very important to the American Cancer Society as well. And so we're going to work to inform that discussion to make sure that patients with ovarian cancer and patients with other cancers have access to the care they need, as part of this process. And if we aren't perfect, then we're going to come back and we're going to keep working at it again and again. But this is a several-year effort, and clearly the interest of the patients that are represented by the Alliance on behalf of the women with ovarian cancer in this country, on behalf of patients with cancer in this country, something that we're very aware of. We have another question. Here, Karen, if I may go on to another one. We okay? I'm having trouble with the audio, so I'm going to assume that's a yes, but we'll go ahead. Here's another question. Does the law help women who are at high risk of developing ovarian cancer? Are you there? Let's go ahead and let's deal with that question. So does the law help women who are at high risk of developing ovarian cancer? And the answer to that is let's say, as part of the essential benefits package, what do we mean by helping women who are high risk? So what we mean is, will we be able, for women who are high risk, we'll be able, unfortunately, the circumstance of ovarian cancer for most women is we don't screen for ovarian cancer because we have not found an effective screening test. But for women at high risk of ovarian cancer, from a medical standpoint, there are recommendations, first off, obviously, for women at high risk of getting blood tests, the genetic tests, and then, of course, if it's positive, like a BRCA, if that's positive, to go ahead and do additional studies. Again, comes back to the essential benefits package. And we need to make sure that women who need medically appropriate screening have access to that screening. And as new tests come online that are proven to be effective, we're able to move them into this process as quickly as possible. So it's an important question. I can give a personal opinion. I think that those are issues that are critically important, and that we have to make sure that this benefit package, and my colleagues here at the American Cancer Society and the Cancer Action Network are also committed to making sure that those types of benefits are preserved. Well, with that, we are getting near to the end of time, so I'm going to end my portion of the.
Len, I'm sorry, we're going to have to interrupt
one more
you
question
now.
that,
I think we could go on all day. We have lots and lots
I take directions from all my colleagues who tell me they're watching.
I want to thank you so much, and
here's a
to
question
tell everybody
how likely are the provisions
that,
you've outlined
again, if we
to
don't
survive
get
in
your
the new
questions
Congress?
Answered.
I think that there are a lot of issues. We believe at the American Cancer Society and the Cancer Action Network, we believe that these provisions are important provisions and are likely to survive, despite the challenges. Because the bottom line is, what we had was not working. I mean, I'm speaking as a person who's listened to a lot of opinions, a lot of discussion. I've been involved in these discussions. I was involved years ago in the former efforts to bring a health care act together. We need to do something because we're sinking. We have great technology. We have doctors who can do wonderful things. We have new drugs. But if we can't get those treatments and those drugs to people, then we've got a problem. If we have an insurance system that's not going to be there when you get sick and need it most, then we've got a problem. We can't ignore that. And it's important, again, coming back to that point, through the cancer lens, that's where your voices become important. So these provisions that we're talking about, we are committed to. We are optimistic that that's going to continue to work. And I do think that at this point, I am going to turn it back to Karen and thank everyone for being with us today, and hopefully this has been helpful in helping you understand a bit more about what the Affordable Care Act means to you and means to many people in this country. Thank you.
Len, I'm sorry to interrupt you. We could really go on all day and answer these questions. We have lots and lots left over. So let me tell the audience again, if we haven't gotten to your question, please email us at advocacy@ovariancancer.org, advocacy@ovariancancer.org, and we'll answer as quickly as we can. Thank you to everyone for participating. We'll send you all a follow-up email in the next few days with answers to questions we could not get to today. And we will send a link to this webinar as a video so that you can watch and listen to it later. To do that, please go to our website, www.ovariancancer.org, www.ovariancancer.org. The webinar will be up tomorrow. And we appreciate any feedback you can provide us about today's webinar and future programming. Please join us also for the next of this series of webinars, which will be held on Wednesday, January 12th, beginning at 1 p.m. Eastern Standard Time. We'll be discussing developing and integrating fundraising into your annual plans. And we'll be featuring Teresa Smith, who is an Alliance board member and a development and fundraising professional. In the meantime, have a safe and happy holiday. My best wishes for a peaceful and a good new year. Goodbye.